Hello, everyone. My name's Solomay Tibabu, and I'm the host of Going Digital Behavioral Health Tech. I'm really excited for this session with Dr. Histon today. Before we get started, perhaps you could give us a brief introduction?
Sure. And Salome, first I want to say thank you for inviting me to be here to present. I've enjoyed as a spectator the last couple of years, so it's an honor to be here. So as you mentioned, I'm Trina Histon. My background is as a health psychologist, and I'm a senior principal consultant at Kaiser Permanente and have been working on building out a digital mental health ecosystem with the team I'm part of for the past several years.
Excellent. Thanks so much. And so, what is Kaiser Permanente doing for our audience to better understand
Sure.
the digital mental health front?
Sure. So if you're not familiar with us, we're one of America's largest and oldest integrated not-for-profit health systems. So we are both the payer and the provider of care. And we started, if I think of the why and the how and the where, if I kind of think of it that way, our why back in 2017 was when we looked at our data, we were seeing about 20 to 25% of our members, that's what we call folks who are part of our care, were seeking care in specialty behavioral health, about 20 to 25% of them. And then when we would do an intake with them, they were sort of, if you look on a medical continuum, they were subclinical. So we were seeing a lot of needs that people were feeling like they needed more help in their day-to-day. And yet they were sort of subclinical on the medical side. And we wanted to explore how might we meet needs differently. So, back in 2017, it feels like a long time ago now, since we've been all living through this pandemic. We were seeing a lot of digital mental health tools and thought that they might be able to, add more sort of at your fingertips convenience for in the moment support for folks who are subclinical. So that was sort of our why. And, the how we leverage human-centered design, which if you're familiar, it's an empathy-based problem-solving methodology. And what that enables you to do is to really go deep with your users. And in this case, there's sort of two sides to it. We have our clinicians, think about therapists, think about psychiatrists, primary care clinicians, and really understanding their workflows and what do they do when somebody is coming in their crisis that may not be sort of meeting a medical threshold, but they need help and support. So what was their current toolbox, if I can put it that way? And so we really learned a lot doing that. And then we also talked to those members and, talked about their care experience and what was going on in their lives that prompted them to reach out. And, clinically, it was sort of a lot of subclinical depression, anxiety, and folks who were sort of moving toward adjustment disorder. They'd had something very disruptive happen in their lives and they were struggling. So leveraging human-centered design and designing with those people's situations in mind, we were able to build out our digital mental health ecosystem, which has two layers. One is a clinical layer. We have 6 apps right now, 3 mindfulness meditation and 3 cognitive behavioral therapy. And a clinician, as part of a referral and a plan of care, can add that to someone's plan of care when they're in care within Kaiser Permanente. And then as we were doing this work, a lot of people don't seek care who struggle. We wanted to build out what we call a self-care option. So via kp.org, our member website, our members today can access Calm and My Strength, one as mindfulness, one cognitive behavioral therapy as part of their care at no cost to them. And they can get that without having it necessarily tethered to a visit, because we recognized we want to be able to put these tools in multiple places. So the where is, self-care and or within clinical care. But what we started out with was about 25 clinicians, and now we've rolled out across all our markets to, over 2,400 clinicians in specialty behavioral health. So that's sort of the story so far, and we continue to optimize that. But it's been a very rewarding journey, and every day there are new lessons to learn. I think it's fair to say, as you build an ecosystem, it's a dynamic living thing.
Wow, that's just remarkable. And this is for adults at the moment?
Yes, at the moment. So what I've just spoken to is adults, 18 and older. But my day-to-day work right now actually is we're expanding the ecosystem for youth mental health. So think about ages 13 to 24, very different. So we have the ecosystem and all the different pieces and, codified workflows into EMRs, but youth have different needs, and that age span from 13 to 24, very different, a lot of developmental things happening, a lot of milestones that sadly young people are missing because of the pandemic. And I think we've all, like even in the New York Times over the weekend, an article on youth mental health and youth in crisis. We were seeing the figures go up before the pandemic, and it's just been a straight curve up, if you will. So we are working to understand their needs deeply, and also similar process of learning from parents, caregivers, youth, and our clinicians, and building out that ecosystem right now. So that's a lot of fun, and it's very different in terms of how you engage and how you make a referral, and all the fun stuff. So we're trying out a lot of different things to see what might stick.
As you alluded to earlier, Kaiser Permanente is a prolific health system. And just by everything that you've just shared, it's clear that you're leading the way with digital interventions for all of your members. And I'd like to just share with our health system audience members, why should health systems consider building a digital portfolio now?
Right. I think it's a great question. I think back as I reflected on our why, it's evolved. I mean, what we saw when we started was we were thinking mild symptomology, subclinical, these tools will be really supportive for those patients. But actually what we've discovered is they're good for everybody. So if somebody has moderate or even severe depression, and again, they're in a comprehensive plan of care, maybe that includes medication, psychiatry, therapy, these tools can be a sort of a way to concretize homework between sessions. And again, a touchstone if somebody's, say, got anxiety and they're feeling life event is prompting that response for them, they know that they've got the tools, on their phone from their care provider that can help them manage through that moment. And then obviously we're there for them too. So I think it's fair to say, as health systems, we have been living through a pandemic. My take is we've probably innovated a decade's worth in the 2 years of the pandemic. We tend to be a risk-averse industry and perhaps maybe slower to innovate as an industry. And I think there are good reasons for that, because, we're providing healthcare, and that's a very vulnerable relationship for somebody seeking care to be. And it's not the same as other consumer experiences. At the same time, consumers are expecting a seamless, fit into my life kind of day-to-day experience, whether it's, going shopping or taking transportation. And they're expecting that of healthcare as well. So I think the pandemic has brought that even more to the fore. And I think the other thing we've probably all done as health systems is pivot to telehealth. We certainly did very quickly. We had sort of all the apparatus in place, and we're just able to turn the dial all the way up to 10, if you will. And over 95% of our visits turned into be virtual care very quickly. I want to say even within a month. So I think health systems have probably had to innovate quite a bit in the pandemic. So A, there's an expectation. B, there is even more need than there was prior to the pandemic. We saw the literature coming out early from China, from Italy, from countries that had very big waves very, very quickly. Stress, insomnia, anxiety, were far more prolific in populations that were going through the surges. And I think we've seen the same data come out of the United States. So the need is there. It's grown in the pandemic. You've likely, as a health system, innovated in some ways over the course of time. And there's an expectation that people will want care, at least a piece of care, to be delivered this way. And they'll want something that's sort of on their time and in their pocket, given the penetration of smartphone use in this country. And I would say to think about building a portfolio or an ecosystem approach, because there is no one app that rules them all, if I can frame it that way. You are going to have to think about your diverse member base and bring tools to bear that support that lived experience. A lot of the early apps were developed in English only. Thankfully, that's changing. A lot more language diversity. And I think, honestly, a lot more diversity in general, because again, consumers will vote with their feet or their eyeballs if they're giving attention to your app. And it's table stakes now to think about diversity, inclusion, equity in your design as you move through that. So they're all the positive things. And I think if you don't start doing this work, you will then sort of get left behind, candidly. That's just where the world is moving, not just the US, but I'm seeing it globally. The time is now. It was probably yesterday, truthfully, but right. There's good places to start, and you're not alone in the journey. And we published in New England Journal of Medicine Catalyst our experience, so we have our lessons learned in there. I can pop it in the chat later on and make that link available. So you're not starting from a zero body of knowledge. You actually can leverage what we've learned, sometimes the hard way.
That's amazing. Yes, I'm excited to share that resource with our audience because,
Sure.
just as you mentioned, all of the important considerations to keep in mind, everything from, you can't just have one solution for everybody. You've got to have a portfolio of different tools for different populations. You've really put those into practice, which is
yes, and they're all different. A lot of people ask me, how did you choose the apps that you chose? And I think back in 2017, we're an evidence-based health system, so the evidence-based drives a lot. So this is why we leaned into apps that were more mindfulness-based stress reduction and cognitive behavioral therapy, because the evidence base was strongest for those two sort of modalities, if you will. And then, so we looked at the evidence, we looked at the early outcomes companies had, and they're growing that now. So it's nice to see the evidence arm almost starting day zero for a lot of startups now, because, as health systems, we need to see that you're reflecting the evidence base. And then I think just as important too is the user experience, because if you've got the best app in the world and nobody uses it because you've developed all the science, but the user experience is just very clunky and not intuitive, people will never use it. So those three areas were super important. We've now evolved that rubric or framework, if I think of it that way, into seven different areas, 78 items that we leverage. And that goes all the way from the evidence base to, your engagement tools, to your company composition, your board, sort of your reputation, how you'll be as a partner to work with. We think about sort of different pricing models that are out there. And then very importantly, sort of the IT infrastructure, privacy and safety, of course, in healthcare. There's regulations that we follow, but then there's expectations because, first do no harm is where we come from. And so really evolving that over time. We don't have expectations that that's all perfect day one, but as we work with you over the years, you'll get to that kind of finish line of having all those pieces in place. So we're learning a lot in that and growing a lot in our thinking too, because the way I see it is, we step into a space together, with humility and start to meet unmet need. And I think we're learning together. So it's a journey that is multi-years in the making, candidly.
Yeah, thanks for adding that, because I'm sure a lot of startups were wondering, how did you come to your...
Yeah.
As well. So you mentioned something earlier around user experience, and it's one thing to have the app available, but if no one's using it, let's talk about engagement, but maybe first, how do you even define engagement?
That's a great question. So there's no standard definition in the literature for engagement. And I think of it in 4 dimensions. There's sort of this model out there called the FIT model, and it's, frequency, intensity of use, the time spent in the app, and then the type of content consumed. So they're sort of the 4 dimensions that I think about. I mean, you can use something frequently, but maybe if you're like me and I'm guilty of this, you see the red notification on an app and that just visually bothers me. So I got to go in, clear it out and empty it and I'm gone. So I might be a frequent user, but I wasn't engaging in any deep way. So that's sort of some of the differentiation there that I'll make. So what we've seen, I think there's been this sense of more use equals better, and I'm not entirely sure that's true in terms of our experience. And the other thing I'll say is, we like to think of dose response in medicine. It's sort of a clear thing to think about. You do this much and this happens. I think of it as in terms of a use response, but I also see there are different ways to use it to get value. And I think in our deployment thus far, we see distinct what I call arcs of engagement. So there's a use pattern that's almost a daily pattern. So whether it's meditating every day or reminding yourself to do a cognitive reframe, or for behavioral activation that you're making a plan to meet friends or go for a walk in the park, that you're intentional about engaging in the tools and techniques that work. And so we see some folks every day, they're in there, doing a tool or doing something every day. That is one arc of engagement. And then there's another that looks more like kind of aspirin use, if I can frame it that way. So it's once or twice, and then it drops, and then it comes back to once or twice, and then drops. So that those individuals are getting value in a time they need it, but no longer than when they need it. So it's almost, and we've heard this from our members, I go there when I'm not feeling good, but they don't think about using it every other day. It's only when they need it. And then another distinct use pattern is kind of what I frame as sort of antibiotic use, like 5 to 7 days use, and then a drop. and then they come back for another 5 to 7 days. So I feel like all of those arcs are valid. And, what I'm seeing now in the more sophisticated apps is they're able to show you a path through how content is consumed, if I can frame it that way, or modules are completed is another way to think about it. That relates to reliable change on a GAD-7 or a PHQ-9. And I think that's, so my expectation is I'm looking for that. I'm looking for symptom improvement if you're leveraging a tool that measures that, whether it's a PHQ-9, a GAD-7, or a perceived stress score, depending on your tool. And I want to see, reliable improvement. And of course, in the world of depression, anxiety, response or remission. And I'll be looking to see what percentages get to those clinical levels. So the clinical benchmarks are very important. And then some apps, they're not appropriate for. So, then I'm thinking about the logins and the content consumed. And over time, as we grow, our sophistication with the data, we will be able to look at sort of a total plan of care on, if someone has diabetes and then they also had depression, and now they're leveraging these tools, what's happening within their whole plan of care, because we know the data is clear if folks have chronic conditions and then they also have mental health issues, that if you improve the mental health issues, then you see an improvement overall in that person's quality of life, and their diabetes improves too. So that's the future of where we're going to go with the data. But that's what we see with engagement. I will reflect that in the published literature, we see about 3.9% of people still engage after day 14. That's a tiny, tiny number. And we're seeing, 4 and 5x factor of engagement, much longer tails of time in our deployment. And I think that's because of how we've done it. It's again, the trusted relationship with your therapist or your psychiatrist, your primary care doctor. And then when you go back in for another visit, so how's that going? How are you using it? And then there's a conversation about, well, other folks who have what you've going on also find this particular tool set useful. So we're very specific in the referral of where to start, but also where to explore next if that's a need within the context of the visit. And I think all of those things contribute to engagement. So I think engagement is just critical, because if you just open the app and download it and you never do anything else, that's not going to work for us in healthcare.
Mm-hmm. Right. And I really like this point that you made, like the clinical benchmarks. It's like the PHQ-9 scores, that's really just table stakes. You've offered our audience a lot more things that they could think of above and beyond that.
Right. Yeah. That's my expectation for of course, there's digital tools that are wellness oriented, then all the way up to digital therapeutics. So I have a lot more expectations around digital therapeutics. But I feel like, the value here is it's been a way to concretize the work you do, in therapy, and it's a way to bring it home with you. And, we've heard from members that, oh yeah, I talked about that with my therapist. And then it becomes alive in a whole new way. And it's personalized in the app experience, because then you're doing the exercises, maybe you're typing in some thoughts, feelings, behaviors, if it's a CBT app, or you're hearing someone leading a meditation speak about something you referenced in therapy, or a concept your therapist you've spoken to them about. And here it is. And now you're meditating to it. So that's the value of being able to do that. And, I do think we need to go beyond the clinical benchmarks to the other value points that digital can bring, because, on paper, you can get to scale and spread and reach far more with a digital tool. And I still think we're ramping up for that, in the entire industry of healthcare. And I still think app companies are trying to solve for that too.
Right.
We're not completely there yet.
Yeah, exactly. That's and I know something that we've talked about in the past has been that health systems, other providers that are using these digital tools, there is so much more that startups can evolve with their data to really inform new insights that we haven't even thought of today,
Absolutely. I mean, I'm excited for that personally, because I think, in digital in general, whether it's for mental health or otherwise, I think we're data rich, but sort of insight poor. And I think the value and the next frontier is to how do you personalize my data and those insights back to me, because, there's a continuous data stream happening. And in healthcare, we might have episodic data happening. So you've got a whole different value proposition from a data perspective. And if we can bring those two together and really deliver new insights about how do we make the experience better? How can we be better as a health system in making that referral even stickier, so more people will say, oh, that's going to really fit for me, and they'll download and begin to leverage the tools and then come back in and, work with their therapist on that. So I'm excited for that. That's the next frontier, I think.
Yeah, you just started to allude to a couple ideas for, at least for the health systems who are just getting started in the audience. Maybe they're just starting to integrate some digital tools. How can they really get that engagement kickstarted?
Yeah, so as I mentioned earlier, we did leverage human-centered design. So if I think about the evidence base, what we'd seen from the literature, implementation science and digital mental health, was there were a couple of barriers. One was confidence, and another belief that, can these tools help? I don't know what they're about. Do I have time to go check them out? And then the other big piece is, how do I fit this in my workflow? I don't, I've got, depending on the care setting, I might have 50 minutes, or I might have 30 minutes, or I might have 20 minutes, or, depending on which kind of clinician I am. And so we really wanted to understand their current state with digital tools, and then see what's going to be valuable for them. So, I think design it with your end users in mind, and really, shadow them. Like, we shadowed phone calls, we shadowed visits. We really saw, where are they clicking in the EMR. We wanted to build, because the app is one piece here. You can have a great app, but if you haven't fit it into the workflows, it's never going to get referred. And so we really spent a lot of time thinking about how a clinician's spending their time, and wanting to make it really, really easy to make the referral, patterning to the workflows they have and the tools they already go through when they're clicking through the EMR. So that was a big piece of it. And in doing that, and we were lucky enough that we were able to kind of roll one out one at a time. So we were able to go really deep, and therapists like, oh yeah, I really like this one because it's got all of this, or it has acceptance commitment therapy and dialectical behavioral therapy as well as cognitive behavioral therapy. So this is mine for members who have this going on. And then the other therapists go, oh wow, that's great, I didn't know that about that. And so all this cross learning. So we codified all of the learnings into what we call an app map referral. And so for different, if I'm having grief issues or sleep issues or stress or, relationship issues, it's very clear which app is strongest for those areas. And so when you're busy as a clinician, you can go to that app map recommendation guide and then go, okay, this person's got a lot of grief going on, which many people do in the pandemic. Then this is the one I'm going to refer the patient to first. So you're making that match right the first time, and really personalizing why you think that's a good solution. So we've codified all of that into training materials. We've built on-demand training, because really I think of it as a digital mental health competency. And so we really wanted to listen to our clinicians who've been with us for many years now in this journey about what's compelling for them, and pull that through the training. So then when we ramped up in 2020, because we really turned the dial up on training folks, we were able to do that. So think about all those pieces, like what's the context of the deployment? How are folks using the EMR, different care settings? Specialty will use it different to primary. We have health coaches as well that also refer, and so they'll have a different instance, they'll see a different patient population. How are you making sure it's easy for them to do that? And then continuing to bring to life what's in the app, because the apps are always changing. And so you want to keep refreshing. Okay, now it has a module on, postpartum depression, for example, or a module on grief. And so we want to make sure that content flow is always coming through. So we have champions groups that meet regularly and share best practices and tips and tricks. And then again, we're always codifying and then deploying. So it's not enough to just put it out there and then walk away. It's a continuous cycle of learning. And that's, to me, what an ecosystem is. It's permeable in what it does, and it's permeable in its learnings, that you're always bringing those through. So they're the things that I think about, and we're still taking care of every day.
Wow. So this is what you mean by integration. I mean, that
yes.
Not only an investment on the staff and training component, but between apps. And maybe I'll ask you, what's the expectation for integration with an EMR?
That's a great question. So we've thought about that, and we're sort of on our data infrastructure next gen journey. Because we wanted to start small and innovate, and then keep iterating on what was working. So as yet we haven't. So let me frame this. So EMR data, as you know, is what we consider category 1 data. And so it never goes away. It's in the EMR, it kind of stays there. App data is often considered like category 3 data or category 4 data. And the quality of it can be quite variable, being candid. And so when we're thinking about what data might we want to bring in from an app, we have to really think about, well, what's the quality of it? Where's the integrity in it? And is it worth bringing all the way in to our EMR? And I think they're sort of questions we're asking ourselves as the space matures, especially on things like PHQ-9, app-derived PHQ-9 versus clinic-derived PHQ-9. So I think that's kind of the easiest journey. So right now with our data infrastructure, we're sort of creating a space where it's almost like a data lake where we have our EMR data, we have the app data, and then we're able to run reports. So we're able to look at referrals, we're able to look at engagement, we're able to look at how long someone stays in that arc of engagement I spoke about, and then we're able to feedback those learnings to our clinicians and say, here's the percentage of patients referred to app A, B, C, D, E, or F. And the why around that, and be able to talk about that. So that's where we're at. I imagine other systems are thinking about the full, bringing all that data in, ingesting it. Maybe they've got a care management team that's looking at data. That's certainly another way to do it. It's not sort of how we've decided to do it yet, but we are, as you can imagine, different apps, whether they began life as a direct-to-consumer and then they decided to be B2B, they're on a journey with their own sophistication of reporting and capabilities. And so I found that harmonizing that is a journey, and that's the one we're on right now, is to harmonize the data coming in so we can look at all the CBT apps, and we've been doing that with pre-post PHQ-9s. We can look at all the mindfulness meditation apps and see, what are the patterns of use between both that are comparable. And I think, some companies have the capability of coming right into the EMR and things can sit on top of it and you can see scores going up and down and act, and then others are not there yet. So I think if you're starting with that, that's a longer journey and you'll have a lot more dev work to do. But if you start with seeing what the signal will be with your clinicians and with your patients and members, I think that's a good place to start. I think we've learned a lot from that to make it scalable, so it holds when you flow it out to 12.5 million people.
Mm-hmm. Right.
Which is our member
really
base.
Good advice for both startups and health systems getting started. At the pilot stage, perhaps you don't have to go full in EMR integration just yet, but
right.
Toward that.
Right. Yeah. Understand the expectations. So your blueprint or roadmap has that in place, but it's going to be hard to do everything day one. And we recognize that app companies are just not going to get every single thing, but the expectation is you will get there if you want to get to scale and spread. You have to be able to do all those things.
Really good advice. And now I've got one more question. What are some lessons learned from a health system on how to be a good partner to startups if they want to pursue this path?
That's a great question. I think about the role you want to play. So do you want to start with companies that are well established? They're down the line with their series funding. They have a robust product. They've worked with other health systems. That might be one place to start. And candidly, that might be where most health systems like to start. But I've also seen, systems be kind of in an accelerator mode. So they're taking a product they really like. Maybe not all the pieces are in play, but the potential is there. And then together, with mentorship and relationship building, you kind of are able to mold the product to what will meet your base. So think about if that's a role you'd like to play. And then I see others still being more like incubators. So they recognize there's a big clinical need. Maybe the space is very nascent, and I think that's pretty fair of the youth mental health space, that it's quite nascent. And you might be in an incubator role, maybe you're reluctantly an incubator, but you're really helping think about your own needs. They're getting clearer to you as you're looking at your data, and then working with app companies, they're able to bring you a new suite of way of thinking. I think, again, I used the humility word earlier, and I think it's important because, we in healthcare, obviously we're looking at a clinical frame, we're thinking about things in a clinical way, and then app companies are really thinking about the user experience and unmet need and how do you engage people and what are their needs. And so it really can be a very synergistic, symbiotic relationship, again, with the humility factor where you're both learning and no one group has all the answers, but you've got a lot of needs. So you're an incubator, you're an accelerator, or you're partnering with a company that's mature. I think time frame wise, my experience has been if a company wants to go directly to maybe an employer group, that's maybe a 1 to 2 year relationship building journey from starting conversations to deployment. If you're going to a health system, my experience again, it's a 1 to 3 year journey from beginning up, ramping up, and scaling, and then optimizing. And then if you're going directly to provider groups, that's a 3 to 5 year journey. So think about, on the health system side, recognize it's not going to be turnkey. You're going to do some work to make sure it fits and meets your needs. And then if you're a provider system, it's probably a longer journey in regards to that. So they're the timeframes I've experienced in my history of deploying to these kinds of tools, which is over a decade now. So, patience and, really being curious, bringing that curiosity, but always keeping the sort of the user at the center, I think is so important. And whether that be a patient or if you're a company, whether that's your user base and what their needs are, and they are going to evolve with those in ways that make sense and be data driven. I think they're all the things that I think about.
Amazing. Thank you so much, Dr. Histon. I always enjoy
very welcome.
Conversations. This was just great advice for both the health systems and startups and vendors in the audience. And I'm excited to see how Kaiser Permanente evolves your digital mental health portfolio.
Me too. Thanks for having me, and best of luck with the conference. I'm looking forward to hearing from other speakers. Thanks for inviting me.
Of course. Thanks so much.
Take care. Thanks, Salome.